Thank you, Chair. And I would try to be very brief, but I would like to use the chance that we have ECDC here, and I would like to address a very crucial issue that needs more attention, which is long and post-COVID, that was underestimated for a long time. And now we're talking about up to 10% of people suffering from mid and long-term effects. And of course, without the vaccine, we would have seen people more suffering. This is for sure. But the vaccine alone does not prevent from post-acute sequelae sufficiently. So my three questions would be, especially to ECDC, but if Mr. Delso, you have the urgent need to say something in addition, of course, I'm very glad. Are you planning to collect EU-wide data about long COVID risks, also in regard to different variants? And also, I know this is very difficult with different vaccination status. And how about a European network of long COVID experts? And in the end, you talked about some guidelines back in April. Are you working on these currently as well? Thank you, Chair, and also thank you to both speakers. And I totally sign what Mrs. van Bremt said. Was highly interested what you presented here today, and I'm very much concerned about long COVID. This is why I also want to connect my second question today to this, and specifically because we have in our title of the committee the lessons learned issue, and as Science Sano has presented a report on a study on COVID impact just very recently by the end of June, we had just to name a few percentages, 47% who have symptoms after the infection, still 32% after 6 months, and then it's only 23% who has the diagnosis received of long COVID after 6 months. So, and exactly what you said about the lack of data, and then bringing in the lessons learned issue right now. Do we underestimate this issue right now? Is it just the money, or is it the political will? What is it that we need to do right now to address this long COVID issue very correctly? That would be very interesting. Kathleen, I'm always eager to please my chair, so this is why I go down to one question and one expert. So, but let me point out with one sentence, because today in the morning I referred to long COVID, and it was answered that time for more data collection was advised and requested, but the people are suffering now, and they need treatment now, and if we do not do something, many patients will emerge, and they have to go through a horrible suffering. So I'm not going to ask on that, but just to make it clear, and I'm not going to come up with a question here. But with admiration, I have to say, Mrs. Reich, and this goes to you, I have to say, Austria managed quite good and performed high and consistently a number of PCR tests, and only those can reliably detect the infections, and also those go to the statistics. So I hope you can tell us something on how Austria did so well without overloading labs, because in Germany this was the argument that we did not do it because the PCR was too much on this. So I hope we can learn something from you on that.